supposed to be succulent, soft. When you notice that it has a thick area, is a sign that something going on in the breast. The beam front, nipple cross, red or hot in your area, new fluid coming from the breast, skin sore, bumps, growing vein, shrinking nipple, the nipple has gone inside, new shape. Your breast is pendulous or maybe rounded, it's now look new shape. It's a sign that there's really something going on. Orange pink skin or hard. It's a sign that there's something going on in your breast and you should seek for a medical advice. Next slide, please. Okay, we have men here, and I think it was nice for me to talk about male breast cancer. The question is, do men have breast cancer? The answer is yes. It accounts for 0.5 to 1% of breast cancer. It's uncommon. Most present at a locally advanced stage of the disease. The risk factors are similar to that of breast cancer. It's commonest in black. That's to say, male breast cancer is commoner in black than in white. The symptoms are similar to that of female breast cancer. They present with a breast mass as very low. Investigations are also the same. Diagnostic workup is the same. Treatment are similar to female breast cancer. The treatment modalities is also similar to female breast cancer. Mastectomy, that means removal of the male breast, radiotherapy, using radiotherapy to treat the chest wall, and then chemotherapy. Next slide, please. What is screening? Why do we advocate for screening? What is the importance of screening? The importance of screening is so that the cancer can be caught early. Because when it's detected early, it can be cured at the end of the day. And early detection saves lives. Screening refers to looking for a sign of a disease before the person has symptoms. Before you even have symptoms, because sometimes if the mass is very small, let's say like 0.5 or 1 cm or even 2 cm, you may not be able to palpate it. But when you screen, you'll be able, the screening modality will be able to pick it on time. The aim is to discover the cancer early so that it can be treated and possibly cured. It helps with early detection, which could be achieved via breast ultrasound, that was omitted, mammogram, and then monthly self-examination. Like I say, mammogram is done for women that are 40 years and above, and then it's superior to ultrasound. It helps to detect the cancer early. Okay, so this is the mammogram machine. It has a blade and then that compresses the breast to take image, and whatever lesion that is there, it can be detected. The superior of all breast screening tests is the breast MRI. Breast MRI is more expensive. We advise women that have a strong family history of breast cancer to do MRI. Also, when a patient has a conflicting results, we palpate the patient at the clinic. We fed a mass. Patient do MRI. MRI is showing that there is no mass there. Or patient do ultrasound, there is no mass there. We ask the patient to do MRI, which is superior to all the screening modalities, and then no exposure to radiation. So this is the MRI machine. It has a breast cup. That is a cup that the woman put her breast inside that fit into the breast of the woman, and then the images are taken for radiographers to read. Next one. Okay, this is self-breast examination. The importance of self-breast examination is for you to be aware of how your normal breast look like. Because if you don't examine your breast every month, you wouldn't know how your normal breast look like. And if you don't know how your normal breast look like, there will be something going on in your breast that you don't know. So self-breast examination is a key, and it's done every month For women that are still menstruating, it's advisable for them to do the breast examination 3 to 5 days after their menses. For women that have gone through their menopause, it's advisable for them to pick a particular date in a month to examine their breast, and it should be repeated every month, same day. Okay, so there are two ways you can examine your breast. The first one is visual, by looking. So how do you cannot just look at your breast this way and you'll be okay. So what you do, you start in front of the mirror without a shirt or a bra. You cannot stand in front of the mirror with your breast that you want to examine you want to look at your breast. No. Except you are doing it for fancy. But if you really want to look at your breast, you stand in front of the mirror without your shirt or your bra. You place your two hands on your waist. This is the mirror. You place your two hands on your waist. You stand like this. Then, or you raise your arm above your head, standing in front of the mirror. So you can do it in two ways. Either your arm above your head or your hand on your waist. You look at your breast from the mirror. What you are looking at is there any redness on the breast? Is there any mass bulging from the breast? Is there any redness on the breast? Is there any, because the nipple is supposed to be outward. But when you notice that you stand in front of the breast and the nipple is inside, oh my God, it's something for concern. And then you check the size, the contour of the breast, the shape. If there's any dimpling like the picture I showed the other time, you'll get to know, and then you will seek for a medical advice. So the second way to examine your breast is by lying down, by sitting, or by standing on your own. So you use your left hand to examine your right breast, and then your right hand to examine your left breast. When you want to examine your right breast, your right hand is supposed to be behind your head. You use the three pad of your middle finger. Don't examine your breast this way. No, you will not be able to pick anything. Your hand is behind your head with the three pad of your middle finger. This is my middle finger. The pad, this is a pad. You now go up, you go down, and then you go circular. Don't forget to examine your axilla, because sometimes there may not be anything in your breast, but there is something in the axilla. So don't forget the axilla. You also examine your axilla. You go this way with the three part of your middle finger, and then you examine it. So that every month, for women that are menstruating 3 to 5 days after their menstruation, and also for women that are already passed through their menopause, it's advisable to pick a particular date. Repeat the test. Repeat the examination every month. This will make you know how your normal breast looks like. By looking at it in the mirror, if the breast is increasing inside, you know. If there's any changes in the breast, you know. By also palpating your breast, if there's any changes in the breast, you get to know. And it's advisable for you to start examining your breast as young as 15 to 20 to 15 years. Because as a patient, when I was a younger doctor at the National Hospital, we have a patient that is 14 years, she has breast cancer. Yesterday, we do a screening. That's a girl of 15 years, she has lump on both breasts. I'm not saying that she has a cancer, but she has lump on both her breasts. So it's actually advice for us to teach our children how to examine their breasts, especially when you have a strong family history of breast cancer. Next one. So this is how it is. You go circular and also up and down. When you are done with the breast, don't forget your nipple, because there could be something going on. You don't know. It's possible that you don't have a lump in your breast, but there is fluid coming out. If you didn't press your nipple, you wouldn't know whether there is fluid or not. So always remember to press your nipple when you are done with the breast examination. Okay, so this this picture is showing that when you notice anything in your breast, please don't forget, inform your doctor. Very important. Okay, so this is the what I just explained now. You stand in front of the mirror with your hand on your waist or above your head. Examine your armpits. Go up and down. Go circular, and also press the nipple. If there's anything there, you get to know. Next one. Next one. Okay. So the question is it possible to prevent breast cancer? The answer is still yes, to some extent. How do you prevent, or how do you reduce your risks? Avoid modifiable risk factors. Like I said, the risk factors are into two: non-modifiable and modifiable. The non-modifiable, there's nothing you can do about it. The risk factors are there. It's run in your family. You have previous history of radiation. You have previous history of breast cancer. It's there. There's nothing you can do about it. But for the modifiable ones, that are the ones that you can actually work on to reduce your risk. Stay away from alcohol. Quit alcohol. It's very important because it's one of the risk factors for breast cancer. Stay at a healthy weight, If you're overweight, start doing exercise to reduce your weight. Physical activities is very important. Breastfeed your child at least 2 years to reduce your risk. And then for women that are postmenopausal, limit hormone replacement therapy because it can increase your risk. Quit smoking. Genetic counseling and testing, very important. Women that has family history, let's say the mother has breast cancer, one of her sisters has breast cancer, somebody from her father's side has breast cancer. So this one, both the mother and she has a strong family history, both from the mother and the father has breast cancer. You don't wait for the cancer to show his face. What you do is you do a genetic testing, which can be done by blood tests. So the importance of genetic testing is that if it is possible, if the test is positive and you have completed your family, instead of you to wait for the cancer to show its ugly head, you remove your breast. Prophylactic breast mastectomy to reduce your risk. And then more frequent breast examination. These are the way to prevent breast cancer. Next one. Thank you very much. This is my email and my phone number.
Thank you for sitting down, sis. Please, and thank you for the speech, ma'am. Okay, please, if you have any questions to ask, please you can signify by raising your hand, or you can write it down if you cannot stand up. Please, any question as regard to what she has said to us? You understand it?